Okay, good morning, students. So like today, whatever we will be discussing, it is already being discussed by your Saban ma'am. So like, and the note is also already provided to you also. You do one thing, so like whatever notes he had given you and the notes that I will be giving you all, now you just compare it. So which one you find easy, you can like inform me later on, okay? And through that, I can prepare the questions, okay? All of you, am I audible?
Yes, ma'am.
Yes,
Okay.
ma'am.
In case if I'm not audible, please inform me, okay? Because sometimes I don't know, nowadays my server is very low. It's ups and down, that's why, okay. Okay, can you see the screen, all of you?
Yes, ma'am.
Yes, ma'am.
Okay, so this is the topic that we will be discussing, okay? This is the renal vascular disease, which you can also call as renal vascular disorder. Disease, disorder, all these are of same thing. So before coming into the main discussion, now, so first of all, like for any topic that we start now, we have to know exactly what does that topic means. That is, we are discussing about the renal vascular disease now. So what is renal vascular disease? As this topic is already discussed by your ma'am now, like, so can anyone share your view, like point of view, like what do you think this renal vascular disease exactly is? Samuel, can you please share your like knowledge regarding this? Samuel, can you please share what is renal vascular
No
disease?
idea, ma'am.
No idea. Okay, you were already taught, but still you don't have any idea. Okay, Srijana, do you have any idea regarding this?
Yes, ma'am.
Okay, can you please share?
Ma'am, these are the diseases of the blood vessels related to kidney or to the
Blood,
kidney.
blood vessels. Oh, okay, okay. Okay, what about others? What about others? Ilasara?
Yes,
Ilasara?
ma'am.
Yeah, do you have any idea regarding this topic?
It is any disease or any abnormal happen in the vein or the kidney.
In the vein or any kind of disorder or any kind of disease that occurs in your vein or in your arteries, right? Okay, okay. That
Yes,
means
ma'am.
all of you have a little bit hints about this. Okay, let us see, okay, what is renal vascular disease exactly is, okay? Some are still joining, okay. Renal vascular disease, what to see, this, it is a varieties of complication, okay, that mainly affect our arteries, our veins, okay, and that of the kidney. Like not the arteries and veins of any other organs, okay, as you are the student of dialysis, so we mainly focus on kidney, right? So that is why like any kind of complications that affect your arteries as well as your veins of the kidney, okay, that is known as renal vascular disease. So from the term itself, renal, from the just hold a minute, there is an earthquake.
Yes, ma'am.
Oh, there is an earthquake, please hold on, okay. I'm so afraid. Okay, cool down now. Can you all feel the earthquake?
Yes, ma'am.
Oh God.
Yes, ma'am.
Okay, okay. I think now okay. Okay, shall we continue?
Yes, ma'am.
Yes,
Okay.
ma'am.
Yes, yes, say. Okay. Okay, so renal vascular disease, okay, as I have mentioned that this is the complication, okay, that mainly affects our arteries and our veins, okay, of the particular organ that is your kidney, okay. And what happens is that this complication, it can affect the blood circulation of the kidney, okay? That is, what happen is that if it affect the blood circulation of the kidney, then what will happen is that it will affect the blood flow, okay, into and out of the kidney. जो हमारा kidney पे जो blood flow होता है ना, so this can be affected. The blood flow can be affected, okay? Blood circulation can be affected because what happens is that these are the arteries, the veins, these are the things that supply our blood is to the kidney, is not it? If the particular like part that where blood is being supplied to the kidney, okay, if that particular part is being affected, then what happens is that obviously it will affect your blood circulation, is not it? So blood circulation affect होने से तो क्या होगा? The blood flow into the kidney also will be affected. And if all this complication occurs, then it may cause damage to the tissue, okay, to the tissue of the kidney. And if the tissue of the kidney is damaged, then obviously you know now that can like ultimately lead to kidney failure, that acute renal failure, chronic renal failure, any kind of kidney failure it can lead. And as well as like what to say, it can also like increase your high blood pressure, because what happens is that when there is a narrowing of our blood vessel, it's not it when our blood vessel is narrow, then there used to be the blockage of the blood flow that ultimately led to this high blood pressure. So this is what all about renal vascular diseases. All of you are clear about this? If not, if you want me to repeat, I can repeat again. All of you are clear?
Yes, ma'am.
Okay. If you have any doubts, you keep on asking. Okay, okay. So let's move on. It's very simple. You just need to understand हमारा arteries or vein पे कुछ complication होने से that is known as that kind of disease is known as renal vascular disease. So okay, so vascular condition, there are like from the topic itself, like you like came to know now that it is a renal vascular disease. So mainly today we will focus on all those diseases. So what are the vascular conditions that will affect the renal arteries as well as the veins? Okay, all those. We will discuss that condition point by point. So if you don't have these notes, like you can keep on writing at least the point, okay? Later on, I will be sending the PDF, but still you write down at least the point. That is renal artery stenosis. In short, we call it as RAS, okay? So these are the vascular conditions that affect your renal arteries as well as your veins, okay? So that is the renal artery stenosis. So let us discuss what is renal artery stenosis. So renal artery stenosis, this is the narrowing or blockage of an artery, okay, to the kidney. That is the artery that supply the blood to the kidney, okay. There will be the narrowing or blockage, okay, that is known as renal artery stenosis. So all of you know now what is stenosis? Srijana, can you please tell me what is stenosis? Stenosis. Stenosis, can you please tell me what is stenosis? What is stenosis? Oh, am I audible? Am I audible?
Yes, ma'am.
Student, am I? Okay, okay.
Yes, ma'am.
Okay, can anyone tell me what is stenosis? Anyone? Ilashara? You have any idea?
No, ma'am.
Okay, no problem. Okay, stenosis means what? It is the abnormal narrowing, okay? Any kind of narrowing that occur in your blood vessels. So that is known as the stenosis. So renal artery stenosis, this is the narrowing or blockage of an artery, okay, to the kidney. Then what happens is that when there is a narrowing, when there is a blockage to the artery, okay, then it will cause the kidney failure and also lead to like increase in high blood pressure, okay. And then this kind of like problem, this kind of conditions, that is renal artery stenosis, okay. Smoker have a greater risk to develop this kind of conditions, okay. Smoker, those who like smoke frequently, okay, smoker, they have a greater risk of developing this that is renal artery stenosis. So and it is mostly common in men, okay, as compared to that of women, because men, what happened is as compared to that of the percentage that of the women and men, nah? So men are most like prone to like smoking. That is why this renal artery stenosis is common, okay, or they have the greater risk to develop this renal artery stenosis, men. So, and in men also, mainly the age between 50 and 70, okay? It's not like from the, if they are men, that means from the young age itself, like they have the chances of developing these vascular conditions. It's not like that. It's mainly the age between 50 and 70. So, and then like high cholesterol, this diabetes, okay? Diabetes, all of you know, nah? It is a like disorders. It occur when there is like hyperglycemia. There is increased level of this glucose, okay? That is the normal value is also known by you all, that is 70 to 140, right? So, and being overweight. So how to know this being overweight, all those, this body mass index, everything I have given you all now, how to find out all this. And then having a family history of cardiovascular disease means अगर किसी का family पे अगर heart disease हुआ, cardiovascular disease means like heart disease, okay? So all these disease are also the risk factor of renal artery stenosis. So high blood pressure is both, you can consider high blood pressure as both the cause as well as the result of this renal artery stenosis. उसका मतलब है कि high blood pressure का वजह से renal artery stenosis हो सकता है, और renal artery stenosis का वजह से high blood pressure भी होता है. That is why this high BP is mainly consider both the cause as well as the result of renal artery stenosis. So are you clear with this point? All
Yes,
of you?
ma'am.
Okay, do you want me to repeat?
No, ma'am.
Okay, okay. If you have doubt, keep on asking. Okay, this is the normal blood flow, right? See, this is how, when there is no narrowing, okay, see, you can see the picture. When there is no narrowing, it's not like, see the blood flow very nicely, but when there, where stenosis, that is when narrowing occurs. See, there is a blockage in the blood flow, okay, it flows, there can be a backflow to the kidney. So this kind of disease is very, very much like, you know, like harmful. It's not good. So that was the first point. So let's come to the next. Next is renal artery thrombosis, okay? So what was thrombosis? What was thrombosis? Because it's the heading itself, it's not it. First of all, you have to know each and every meaning. Otherwise, how you will be able to study? It's not renal related to kidney, artery, you all know. And what is thrombosis? Darshana, do you have any idea what is thrombosis? Darshana, you have any idea? You just need to respond and say yes or no. Otherwise, I will feel bored. What about Ishan? Do you have any idea what is thrombosis? It's not the first time that I'm asking. I have given the notes this already. What is thrombosis? Okay, Srijana, can you please tell me what is thrombosis?
Ma'am, blood clot.
Yes, Samuel, very good. It's blood clot, okay? Renal artery thrombosis. So there is a blood clot, okay? This is the blood clot that occur in your artery. From the name itself, renal artery thrombosis. So thrombosis ka matlab hai blood clot. That means blood clot will arise where? In your renal artery. That is very simple, okay? So renal artery thrombosis, this is the formation of a clot in a renal artery, okay? And this, what happened is that this thrombosis, from the name itself, you know, it is blood clot. So if there is a blood clot, it may block the blood flow, okay? It may block the blood flow to the kidney. And then this, if there is a like a blockage in the blood flow, then what happens is that that can ultimately lead to kidney failure. So that is what all about renal artery thrombosis. So are you clear, all of you? What is renal artery thrombosis?
Yes,
ma'am.
yes,
Okay,
ma'am.
so this is also like the second vascular condition, okay? These are all the vascular diseases. So you can see the picture, this renal artery thrombosis. Aisa blood clot hota hai. See, this is how it clot. See. Okay, moving on to the next point, that is renal vein thrombosis. The other one that we discussed was renal artery thrombosis. Nah? So now Ilasara, can you please tell me what is renal vein thrombosis? Because from the previous point itself, you can differentiate.
Yes, ma'am.
Yeah, yeah. Can you please tell me what is renal vein thrombosis?
There will blood clot will arise in the renal vein.
Yes, very good. Okay, thank you. So from the name itself, like you can know, now renal vein thrombosis, and renal, you know, vein, you know, thrombosis means blood clot. So the renal vein thrombosis, this is mainly the formation of a clot, okay, that arise in the like vein of the kidney. So you can see the picture. This is how the like blood clot occur. Okay, see, you can see the bluish like this. This is how the clot formations occur. This is the renal vein, right? This is how the clot arise. You can see here. So this was the second vascular condition, okay, that you could find. So all the 3 points that we have discussed, all of you, are you clear? The first one was renal artery stenosis. In short, we call RAS. The other one is renal artery thrombosis, and the other one is renal vein thrombosis. So with these 3 points, all of you, are you clear?
Yes, ma'am.
Yes,
Okay,
ma'am.
okay, then let's move on. Okay, next one is renal artery aneurysm. Okay, aneurysm. Try to pronounce it very nicely. Okay, it's renal artery aneurysm. So renal artery aneurysm, this is a bulging. Okay, this is a bulging. All of you know na bulging kya hota hai? So when you try to bulge out the flat balloon, I know how it bulge. So renal artery aneurysm, this is the bulging weak area in the wall of an artery of the like kidney. Okay, so there will be bulging in the this weak area in the wall of the artery of the kidney. Okay, किडनी का आर्टरी जो है ना उसका वॉल पे वो bulging होगा, so that indicate renal artery aneurysm. Okay, if bulging arise in the weak area in the wall of the artery of the kidney, then that is known as renal artery aneurysm. So most of the aneurysm are like that bulging. Okay, जो bulging होता है, that is aneurysm. So most of the aneurysm are small, and it might cause symptoms, it might not cause symptoms. तो उसका symptoms asymptomatic भी हो सकता है. Okay, so that is why like it is mainly actually asymptomatic. So we call it without symptoms. So renal artery aneurysm, these are not common, okay, as compared to that of all the vascular condition that we have discussed, all the 3 points. Now, as compared to all those, this condition is uncommon. And these are often found during diagnostic procedure, which is performed in relation to other conditions. So there might be like some people have kidney failure, okay, and they have like problem in their kidney, which is associated with any other health condition, okay. Like so or in that case, what happened is that suppose you went to the hospital with other health problem, and in that case you are being diagnosed with this renal artery aneurysm. Okay, that is why this condition is not mainly like how to say, it's not mainly common, and it is not easily diagnosed. That is why here in the last line it is written that it is often found during diagnostic procedure which is performed in relation to other condition. So दूसरा condition का वजह से जब ये diagnostic evaluation investigation perform करते हैं ना, तब like we find out this condition. So are you clear what is renal artery aneurysm? There will be bulging in the weak area in the wall of your artery of the kidney. So are you clear, all of you? See, you can see the picture. ऐसा bulging होता है. See, this is the renal artery aneurysm. Okay. See. Can you see the picture?
Yes, ma'am.
Okay. Okay. So this was the 4th number, right? Okay. This is the 5th number. That is atheroembolic renal disease. Atheroembolic renal disease. Try to pronounce it nicely, okay? It's atheroembolic renal disease. So this this embolic disease, this mainly occur when a piece of plaque that is from a larger arteries, okay, it breaks off and travel through the bloodstream, blocking the small renal arteries, okay. And then atheroembolic renal disease is becoming a common cause of kidney problem in the older adults, or simply you can call it is elderly. So what is atheroembolic? What is atheroembolic? Anyone have any idea?
No,
These are already discussed to you all. It's not a new thing. I did not discuss, but your ma'am already discussed. So obviously we have some like idea about this. Anyone? You can share. Anyone have any idea? Anyone have any idea what is atheroembolic? Atheroembolic.
No, ma'am.
So atheroembolic, this is like atheroembolic means from the first line itself you can see this is atheroembolic क्या है? ये एक renal disease है. Okay, this is the name of the disease. Okay, कौन सा वाला organ का disease? Mainly renal disease, not the other organ. Okay, so atheroembolic renal disease. This is the like renal disease. It occurs mainly when a piece of plaque. Okay, a piece of plaque from the aorta or else from a larger arteries. Okay, so a piece of plaque from a larger artery is break offs. Okay, जो larger artery जो है ना break करता है, when it break off and then that particular break off it travel through the bloodstream. Okay, so जो छोटा छोटा artery जो break off हो रहा है ना, larger artery break off होने से तो छोटा छोटा piece में break off होगा, and then all those break off it will travel through the blood. Obviously, when it travels through the bloodstream, then it will block the small renal arteries. Okay, so if the larger artery break off, it travels to the bloodstream and it block the small renal arteries. So that is all about atheroembolic renal disease. So what is plaque? PLAQE. Because you're mentioning now in the first line that atheroembolic renal disease, it mainly occur when a piece of plaque from a larger artery break off. जो piece of plaque है वो break off होगा बोला ना larger artery से. So what actually is breaking off? That you need to know the meaning. So do you have any idea what is plaque? PLAQE. PLAQE. Anyone?
No.
Anyone?
No, ma'am.
Any idea? Darshana, you have any idea?
No.
Plaque means you can simply call this like abnormal patches of tissue. Okay, small abnormal patches of tissue. Okay, these are the abnormal patches of tissue on a body part or on organs. Okay, small patches hota hai, small like tissue patches hota hai. That all those small tissue patches. Okay, all those from the that is formed from a larger artery. Okay, you mainly find in a larger artery. Okay, all those like all those these patches. Okay, all those patches of tissue you find in a larger artery. So in there itself it break off. Okay, and once it break off, then like all that break off part, it will travel through the bloodstream and then ultimately led to blockage of the small renal arteries. So that is all about atheroembolic renal disease. So and it is becoming a common cause of kidney problem. Okay, so ये atheroembolic जो renal disease है ना, जो स्मॉल पीस ऑफ प्लेक जो ब्रेक ऑफ होता है ना लार्जर आर्टरी में, सो ये वाला कंडीशन वो बहुत आजकल बहुत कॉमन है. सो इट इज बिकमिंग अ कॉमन कॉज. ओके, फॉर क्रिएटिंग अ किडनी प्रॉब्लम. सो ये छोटा piece of like patches that break off. Okay, because of this condition you can find many like kidney problem that relate to this problem. Okay, and this kind of problem is mainly seen in the older adult, that is in the elderly. So are you clear? All of you? It's very simple. All of you? I can't hear anyone's voice. Are you clear?
Yes, ma'am.
Yes, ma'am.
Okay. Shall we move on?
Yes, ma'am.
Okay. So let us discuss the risk factor. Okay. So risk factor सबको पता है risk factor का मतलब क्या है. Risk factor, let us see the risk factor for renal vascular disease. Okay, so risk factor, किन लोगों को ज्यादा chances है ये renal vascular disease develop होने के लिए, किन लोगों को ज्यादा chances है, who are more susceptible, who are more prone to develop this kind of like the renal vascular disease that is known as the risk factor. Okay, so let us discuss one by one. That is age. So there is you can also differentiate in the age, okay, that as compared to that of the young age, the older age, that is the elderly, the elder age, they are more like susceptible, they are more prone to develop this renal this vascular disease, okay. जो लोग उम्र में ज्यादा हो जाता है ना, older age, तो उन लोगों को क्या होता है कि ये disease develop होने में ज्यादा chances होता है, risk होता है. So next is female gender. So male से ज्यादा, so male से ज्यादा female gender को ये renal vascular disease होने का ज्यादा chances होता है. So let me explain in English. So as compared to that of the male, the female gender are more susceptible to develop this kind of this problem, that is renal vascular disease. So are you clear with the two risk factor? All of you?
Yes, ma'am.
Yes,
Okay.
ma'am.
Yes, okay. Next, atherosclerosis. Atherosclerosis. So atherosclerosis is also the one of the risk factor to develop renal vascular disease. So let me ask you, what is atherosclerosis? Atherosclerosis. Response, oh God, atherosclerosis क्या है? मैंने already explained कर दिया. What is atherosclerosis?
Better to known as hardening of the disease.
Hardening of the
Disease.
can you please say loudly, clearly, slowly and clearly? Srijana, please take attendance. Okay, only 10 minutes left. Okay.
Better to known as hardening of the disease. It is a common disease in kidney patients.
Okay. Anyone have any other idea? What is atherosclerosis? Anyone have any idea? Atherosclerosis? Any idea? Atherosclerosis is very simple, na? No need to like think it so deeply, na? Ye simply it is the जब क्या होता है, like मैं कैसे explain करूँ, like when our fats, okay, जब fats build up हो जाता है शरीर पे, जब fats build up, बहुत ज़्यादा fats build up हो जाता, and then when there is a buildup of cholesterol, any other substances, okay, in your artery wall, जब हमारा artery wall पे ना, हमारा artery wall पे जब बहुत ज़्यादा fats, cholesterol और कुछ भी substances बहुत ज़्यादा build up हो जाता है, that is that when obviously when things are building up, that there occurs the hardening, narrowing, it's not it, that is known as the atherosclerosis. Okay, so coming to the next, all of you clear now what is atherosclerosis?
Yes,
All of
Yes,
you?
ma'am.
Okay, atherosclerosis. And if you still want to know the meaning, I already give you all, just check it out, okay? So next, high blood pressure, that is hypertension. So मैंने पहले बोला था कि hypertension can also be the cause as well as it can also be the result. So high blood pressure, that is hypertension, okay? Particularly new onset of high blood pressure, hypertension in an older person. So new onset का मतलब है कि अभी suddenly means you never used to have a high blood pressure, okay? And suddenly you felt dizziness or something, okay? So तो क्या होता है कि on the spot you just check your BP and then your BP is like so much high. Maybe so much high means maybe it is above 140 by like 90 or 80 mm of Hg, okay? So when your BP is very much high, that is on the onset, okay? So the especially in older person, not in the young person, okay, or not in the adult, it's mainly in the older person. तो जब BP अचानक से बहुत ज़्यादा हाई होता है, so those are like can be the risk factor of developing this renal vascular disease. And next is smoking. Smoking, though you all already like know, na? Smoking can be so much harmful. Okay, and then high cholesterol, अगर high cholesterol, intake of high cholesterol, जब हम लोग जब शरीर पे बहुत ज़्यादा high cholesterol होने से there will be deposition of all the fats and all, is not it? So that can lead to develop all this renal vascular disease. So next is diabetes. So diabetes, so all of you know diabetes. So these are the risk factor, okay, that can like cause renal vascular disease. So all of you, are you clear till now? Like what is renal vascular disease exactly is, and what are the vascular conditions, okay? All those diseases, I have discussed the 5 points. Then apart from that, we reach still the risk factor. So are you clear everything?
Yes, ma'am.
Okay. All of you? I could see only one voice. I could hear.
Yes,
All of you
ma'am.
are
Yes,
okay.
ma'am.
Okay, 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 very good. Okay. So like I will with that same link now you join after a minute. I will inform you all. So and you inform me as well if you will be having any class, okay? So like because I don't want to disturb any class. So in case if you have like any class, inform me. If not, I'll continue. So that like in the evening I have a class at 3:15 now, so you can take rest at that time, and then again at 10 something also you can take rest. So for now, that's all, okay? For now. So thank you, everyone.
Thank you, ma'am.
Thank you, ma'am.